What gave you a passion for this whole issue of healthcare?
I'm a father, I'm a husband, and I've been a patient, and we lived around the world. And I began to notice in other countries we were using their healthcare systems, we've got really good care, just as good as America. We didn't wait very long, and the prices were like nothing. I mean, they were a tenth as much as you would pay in the U.S. for the same treatment. So I started thinking, how do you do that? And I began looking at other countries' healthcare systems. And, Nell, it turns out all the countries like us, industrialized democracies, they cover everybody. And on average, they spend about half as much as we do on healthcare. So just as a reporter, I got interested in how do you do that?
Well, you say there are three primary reasons why they're able to do that and how they're able to deliver high-quality care at half the cost that we can here. I'm asking you now to boil it down. It's in a whole book, and it's in your documentaries. But really, what are the three key things?
The most important thing is to decide that you're going to cover everybody. One of the questions I asked in my book was, how do you cover everybody? But it's just as important to ask why. Why would a country commit to provide health care for everybody? And it turns out that all the other industrialized democracies decided this was a moral imperative. As a rich country, they had an obligation to care for the least of their brethren, which you would think is part of our Western Judeo-culture too. The U.S. is the only one that hasn't met that moral commitment. And here's the deal. Once you commit to cover everybody, you can design a system that does it. And some countries have done it with socialized medicine, with big government, government-run hospitals. But a lot of countries, Germany, Netherlands, Belgium, Switzerland, Japan, et cetera, cover everybody with private docs, private hospitals, and private insurance. So it really doesn't matter the mechanism. What matters is making the moral commitment. And if you don't make the moral commitment to cover everybody, then you get a system where some people get really world-class care in great hospitals, that's America, and 50 million people are uninsured and don't even get in the door till they're sick enough to go to the emergency room. That's the fundamental difference. And my argument is the problem with our healthcare system is that we never made the moral commitment to provide health care to everybody.
That's the one step. The other step, though, you mentioned is it's not just making that decision. We tend to get focused on the mechanism to pay for it as opposed to what those other countries did, which was we're going to just provide it. But isn't that a necessary element of it? You have to figure out how you're going to pay for it. We have 300 million plus Americans. If we're going to cover them all, there has to be a way to pay for them.
Well, what a good question. And the fact is, if you cover everybody, you spend less. You want proof? Look at all the 12 countries in my book. They provide health care for everybody. They provide health care for all their illegal aliens, too, because they don't want to separate them out in the emergency room. And yet they spend half as much. Now, how can that be? You cover more people and spend less? Well, one reason is because everybody's covered, they can cover people the most efficient way. I'll give you an example. About 30,000 times a year in our country, a woman shows up in the emergency room, 9 centimeters dilated and ready to give birth. She's never seen a doctor. And those are the $1 million babies. Those are the $1 million deliveries because nobody's dealt with their medical problems. In all the other countries, rich countries, a woman has prenatal care because everybody's covered. And for the cost of 1 week in the neonatal intensive care unit, you could provide 1,000 women with prenatal care for 9 months. So by leaving people out, we end up spending more. Obamacare requires that the insurance companies cover everybody, sick or well. And the only way that can work is if everybody is in the risk pool, is everybody has insurance. Otherwise, people wait till they get cancer and then buy insurance. And the insurance company is going to go broke in that circumstance.
You said there are two other elements. One is our healthcare system literally must work as a system, not be quite as parochial as it has become with the doctors, the specialists, and nobody really talking to each other. And the second thing was everyone involved in that system must pay attention to costs. And driving down costs and being as efficient as possible has to be part of it.
All over the country, I found doctors who said, I came out of medical school determined to protect the physical health of my patients. But now I feel I'm obliged to serve the fiscal health of my community by keeping costs down. And working together, you can have a whole bunch of different medical practices. You can have competing hospitals, competing insurers. But it's best if they combine and work together as one system. I'll give you an example. You take a hospital, say a 300 or 400 bed hospital in central Pennsylvania. In their billing office, they're going to have 500 different forms from this payer and this government program and that government program. In Canada, a 500-bed hospital has one form. That's it. And so therefore, a 500-bed hospital in Canada, the billing office is one person. In Pennsylvania, it would be 100 people. And the extra money in Canada goes to serve patients at lower costs. So making things simpler, making just sort of smoothing out the administrative problems makes a huge difference in cost.
One of the things you pointed out, too, was this idea of a patient-centered medical home. You found communities where that was their model. Explain what that means and why that actually kind of gives you that cradle-to-grave coverage so the doctors know exactly what's happening to you and can get to you faster.
Patient-centered medical home, this is a huge buzzword in healthcare at the moment. I'm not sure what it means. Everywhere I went in America, people said, yeah, I'm running a patient-centered medical home. But were they? I mean, what does it mean? The place we saw at Group Health in Seattle, this is a system that covers 600 people, way below the average cost. What they do is they have a clinic with maybe 20 doctors in different specialties. And in the morning, they all get together, and each one says, well, today I'm going to see Mr. Jones, I'm going to see Miss Smith, and they all consider her their patient. They don't switch off one to another. So they're kind of building it around the whole body. They don't treat people as a headache or a sore knee, but as a human with a lot of different problems. And that turns out to provide very good care, and it saves money.
Well, you know, it's interesting you say that, because I'll bet there are viewers out there who have had the same experience. You have an issue, you go to the doctor, but while you're there, you actually have a few more issues. And when you go to ask the doctor about it, they give you that exasperated look because, as I understand it, they can't bill for those other things. They can only bill once for this item. But to me, that's ignoring the totality of the patient and what is wrong with him or her.
No, I agree with that. And a lot of times, you know, the next day you say, oh, I forgot to mention that cough. In a good system, you can send an email or call the doctor and she'll answer you. I can't get an email back from my doctor. She's not paid to answer emails. But in these medical homes, that's part of their job, is answer phone calls, answer emails. And so it's just a more effective way to deliver care. The other thing is your doctor says, well, I'm going to put you on 400 milligrams of tetracyclithorazine. And she may not know that you're already on 200 milligrams of some other drug that doesn't work very well with thorazine, you know. So an intelligent system would provide the doctor all that, and that's kind of what a medical home is, where they treat the whole patient and not just your hangnail. If I were sick, I would go right down the street in Colorado, USA, and the reason is I have great insurance. And people with good insurance in the United States are going to get the finest care in the finest hospitals. This is why Arab sheiks fly to the Mayo Clinic. The problem with our system isn't me or you. It's the 49.9 million Americans without insurance. And quite often, they don't have any access to care until they're sick enough to go to the emergency room. They live in a big city. There may be a public hospital or a free clinic. But tens of millions of Americans really can't get to the doctor. And this bugs me, Nell. We're the richest country in the world. We ought to be able to provide health care to all our neighbors. You know how many Brits die because they can't see a doctor? 0. France, 0. Other countries don't let this happen. We don't have to let it happen. This 32-year-old college grad in my book who dies on the first page of lupus, you know, most lupus patients live to be 85. They get decent care in America, but she was... One of these Americans fell into this pocket. She was too rich to get Medicaid and too poor to buy insurance and pay for her care, and she died. No American has to die of treatable diseases for lack of a doctor. I know we don't have to do it because it doesn't happen in other countries.